Reality check. The Obamacare architect says if you like your doctor, you can keep your doctor, is true. But there's a catch. This is Special Report. Good evening, I'm Brett Baer. In politics, two people look at the same exact event in two completely different ways. Millions of Americans know firsthand that they could not keep their plan or their doctor like President Obama promised. To many people, that statement is a lie and it undermines trust. But to others, apparently that statement is still true, with a major caveat. Meanwhile, visitors to the Obamacare website are seeing what plans are costing in detail, and while those vary, you might suffer some sticker shock when you hear how much the website cost. We have Fox team coverage tonight. Peter Ducey looks at the revamped Obamacare site. But first, Chief White House correspondent Ed Henry has the latest from the White House. Hi, Ed.
Brad, the administration made sure that healthcare.gov got a fresh new look over the weekend, but the White House is still facing an old familiar problem: questions of credibility over how they sold this law to the public.
First, President Obama and his aides had to adjust his promise that if you like your health plan, you can keep it. Now, one of the architects of the law, Ezekiel Emanuel, is adding a new caveat to another old pledge.
The president never said you were going to have unlimited choice of any doctor in the country you want to go. Let me just finish.
Wait, no. He asked a question. If you like your doctor, you can keep your doctor. Did he not say that, sir?
He didn't say you can have unlimited choice.
It's a simple yes or no question.
If you want to pay more for an insurance company that covers your doctor, you can do that. This is a matter of choice.
Republicans say that's a creative way of shifting the argument to you can keep your doctor if you want to pay for it.
We got to remember, back in 2009 when this law was being debated, 85% of Americans maybe weren't satisfied with the price of the health care, but they liked the health care plan they were on. They liked their doctor. But this administration decided to destroy the entire system to provide a strong social safety net. You didn't have to do that.
The president's allies continue to tout the benefits of building up that safety net. His political group, Organizing for Action, held nearly 100 events this weekend in New York, New Hampshire, and states all across the country. The president tweeting out today that many Americans without insurance are getting coverage by expanding Medicaid, while the administration released a report noting that 60% of the 4.2 million uninsured African Americans might qualify for Medicaid, the Children's Health Insurance Program, or tax credits to lower their premiums.
They can either score short-term political points by attacking the Affordable Care Act and blocking Medicaid, or they can save taxpayer dollars and ensure that thousands of their citizens have access to quality, affordable health care.
The cost to taxpayers, though, could be astronomical. A new report by the conservative nonprofit group National Center for Policy Analysis claims that in one state alone, Arizona, Medicaid expansion will cost taxpayers about $1 billion a year. Emanuel stressed that he still believes enough young and healthy people will sign up to pay into the system and help balance it out.
I think there is going to be a fiscally sustainable number.
Now, meanwhile, some state officials are warning there's another problem with healthcare.gov. It's telling some people they're eligible for Medicaid when in fact they're not. USA Today reporting today that could lead to scores of people dealing with this glitch and not being able to get insurance before the December 23rd deadline to enroll, Brett.
Ed Henry live on the North Lawn. Ed, thank you.